Tuberculosis, or TB, as it's commonly called, is a contagious infection that usually attacks your lungs. It can spread to other parts of your body, like your brain and spine. A type of bacteria called Mycobacterium tuberculosis causes it. In the early 20th century, TB was a leading cause of death in the United States. Today, most cases are cured with antibiotics. But it takes a long time. You have to take meds for at least 6 to 9 months. In the 20th century, TB was a leading cause of death in the United States. Today, most cases are cured with antibiotics. But it takes a long time. You have to take meds for at least 6 to 9 months. Tuberculosis types a TB infection doesn't mean you'll get sick. There are two forms of the disease, latent TB. You have the germs in your body, but your immune system stops them from spreading. That means you don't have any symptoms and you're not contagious. But the infection is still alive in your body and can one day become active. If you're at high risk for reactivation, for instance, you have HIV, your primary infection was in the past 2 years, your chest X-ray is abnormal, or your immune system is compromised, your doctor will treat you with antibiotics to lower the risk for developing active TB. Active TB. This means the germs multiply and can make you sick. You can spread the disease to others. 90% of adult cases of active TB are from the reactivation of a latent TB infection. Tuberculosis signs and symptoms. There aren't any for latent TB. You'll need to get a skin or blood test to find out whether you have it. There are usually signs if you have active TB disease. They include, a cough that lasts more than 3 weeks, chest pain, coughing up blood, feeling tired all the time, night sweats, chills, fever, loss of appetite, weight loss. Tuberculosis prevention. It may sound like a disease of the past, but tuberculosis, or TB, is still a real concern today. And as the old saying goes, an ounce of prevention is worth a pound of cure. In other words, the best way to be well is to avoid getting sick in the first place. Treatment for tuberculosis. Treatment for latent TB. There are two types of TB, latent and active. Depending on your risk factors, latent TB can reactivate and cause an active infection. That's why your doctor might prescribe medication to kill the inactive bacteria, just in case. These are the three treatment options. Isoniazid (INH). This is the most common therapy for latent TB. You typically take an isoniazid antibiotic pill daily for 9 months. Rifampin, Rifidin, Rimactane, you take this antibiotic each day for 4 months. It's an option if you have side effects or contraindications to INH. Isoniazid and rifapentine, you take both of these antibiotics once a week for 3 months under your doctor's supervision. Treatment for active TB. If you have this form of the disease, you'll need to take a number of antibiotics for 6 to 9 months. These 4 medications are most commonly used to treat it: ethambutol, myambutal, isoniazid, pyrazinamide. Rifampin. Treatment for drug-resistant TB. If you have a TB strain that doesn't respond to the usual medications used to treat TB, you have a drug-resistant strain. This means that you will be treated with a combination of second-line drugs, which may be less effective. You will need to take these drugs for a longer period of time. If several types of medications don't do the job, you have what doctors call multi-drug resistant TB. You'll need to take a combination of medications for 20 to 30 months. They include antibiotics called fluoroquinolones, an injectable antibiotic, such as amikacin, Amikin, capreomycin, Capistat, and kanamycin. Newer antibiotic treatments, such as bedaquiline, serturo, ethionamide, Tricator, and para-aminosalicylic acid. These are given in addition to other medications. The new drug pretaminid is used in conjunction with bedaquiline and linezolid. Scientists are still studying these medicines. A rare and serious type of the disease is called extensively drug-resistant TB. This means that many of the common medications, including isoniazid, rifampin, fluoroquinolones, and at least one of the antibiotics that are injected, don't knock it out. Research shows that it can be cured around 30% to 50% of the time. Side effects of treatment. Tell your doctor right away if you have any of the following symptoms: fever for 3 or more days, pain in the lower abdomen, itchiness or a rash, nausea, vomiting, or no appetite, yellowish skin or eyes, dark or brown urine, tingling, burning, or numbness of the hands and feet, fatigue, easy bruising or bleeding, dizziness. It's important to take every dose of your antibiotics. Don't stop, even if you feel better. If you don't kill all of the bacteria in your body, the remaining germs can adapt and become drug-resistant. To help you remember, your doctor may need to watch you take your medication. This is called directly observed therapy. It's recommended for treatment programs where you take antibiotics a few times a week instead of every day.